Welcome back to another episode of Pretend I Don't Know Anything. Once again, I'm here with Grant Young, Director of Admissions at Lighthouse Recovery, and we are discussing levels of care. This episode, we're going to dive into inpatient, or otherwise known as residential treatment. So for starters, let's start with kind of a definition of inpatient / residential treatment.
Sure.
And what that entails, what it is.
I mean, traditionally, 28 days, 30 days. I know that has shortened because of insurance coverage. Mm-hmm. But typically speaking, a residential program, inpatient, is where you go and live, pack a bag, and you go and live. There is medical staff, 24-hour nursing, things of that nature. Mm-hmm. You don't have access to the outside world. In most cases, things have changed where you can have access to your phone and your computer. But traditionally speaking, it is a educational and, I don't want to say isolation, but isolation from the real world, where you are able to go and be educated and get stabilized, and you're removed from your normal environment, if you will.
Yeah.
So you're not in your apartment, you're not in your home. For the next 30 days, you're in an inpatient treatment center.
Well, and this is what, when people think of treatment, generally speaking, they're thinking of inpatient or rehab.
Yeah, and right? Most likely a hospital type feel.
Yeah. I know where a lot of people go wrong in this is that they have the preconceived notion that if I send my loved one to residential treatment or inpatient, if I send my loved one there, then they're fixed. That this is like a surgery, right? And in reality, the process of recovery is not like that. It is a lifelong journey through it for each individual that's stepping into it. And this is just the beginning.
Yeah.
You know, I know I equate this a lot to families when I'm talking to them is residential's like going to pre-med, you know, like this is the beginning education. I don't want an individual coming out of, you know, their bachelor degree in pre-med performing surgery on me, right? They're not ready for it. There's other stages that come on. But people tend to think that that's the case.
Sure.
I don't know if it's something, I don't believe it's something that's been propagated by the treatment industry in general. It's just how people have viewed it throughout years. And I hear that all the time. Like, yeah, I mean, we did it. It just doesn't work. And it's like, well, what did you do post?
Right.
Right.
Well, people want to go to the gym for 12 hours and be big and strong.
Yeah.
And that's just not the case.
Myself included.
Yeah. I mean,
yes.
It's a long, ongoing process to get to that ultimate goal.
So let's talk about, that there are different types.
Yeah.
Right. There's different lengths of stay. There's different types of residential treatment. I say it all the time. If there was one type of treatment in general that worked for every single person, then there would only be one treatment. That's it. Right? So understanding the different treatments and what may be best for your loved one is key in all of this. And quite honestly, I feel like it's impossible to really understand that without kind of an insider view into it all. Yeah. As if you're just doing Google searches, it's not going to encompass what you need, right? Right. But why don't we start here with kind of the different levels?
Yeah.
Okay. 'Cause I think the best way to even begin understanding different types of residential treatment is to understand that there's different lengths of time.
Yeah, there's, I mean, 30, 60, 90. I mean, I haven't seen many past 90, unless you get an adolescent. That's a little bit different. But for adults, traditionally speaking, it's around 30 days. There are a lot of 45-day tracks now. There are 60 days and there are 90 days. That's kind of the world that we live in, or at least that I know of. Yeah. And there's a bunch of subcategories of what that experience would be like for someone, depending on the place and depending on the length of time.
So what would be the benefit of, without talking about all of the other things that could go on, right? Specializations, et cetera.
Yep.
But what would be the benefit of 45, 60, 90 versus 28, 38 day?
I mean, my own personal experience is I was still testing positive on a drug test 20 days in. 28 days in. I mean,
Yeah.
seriously. I mean,
Yeah.
I was in inpatient treatment for 44 days. That's as long as insurance would allow me. This was 12 and a half years ago. Things are different now.
Yeah.
But I think if an individual goes into an inpatient treatment center, generally speaking, a lot of it, the first 7 days, let's call it, is usually a detox period. We're not really going to groups. We don't feel great.
Yeah.
That's why we're in detox, so that we can come off of these substances, number one, safely, and number two, as comfortable as you possibly can. So there's no education happening in the first 7 days, generally speaking. You're on an IV fluid. You're trying to eat food. You're trying to stay hydrated. You're getting stabilized. Probably taking some new medications that we've never heard of, in order to try to get kind of leveled out. We're still testing positive,
Yeah.
especially like a THC or something like that.
Yes.
After the 7 days, we now have, traditionally speaking, 21 days, if we're talking about a 30-day program. Those 21 days, you then begin going into like groups and starting getting educated on those things. For a guy like me, who was 20 years old, I needed longer than 30 days of inpatient treatment center. I needed longer of a separation or a step down in level of care. I wasn't quite ready just yet. And so staying those extra 14 days were really helpful for me. I could have probably benefited for longer, 60 or 90 or something. But it truly does come into does this person need more time at this facility? I'm a big believer in the treatment centers that do not determine length of time on the front end. They may have minimums, like we're a 30-day at minimum or a 45 at minimum or a 60 minimum. But to come up with, this is your start date and this is your discharge date, I like the ones that don't always just determine the discharge date. It can be difficult to do because that's how insurance works, right?
Yeah.
Unfortunately. But the ones that we like to work with can be a bit more flexible about that, where
Yeah.
they're starting to take into consideration what's best for the client as a priority, but also operating a business as a secondary, if
Yeah.
that makes sense, instead of the other way around.
Well, I do want to clarify. The common terminology is 30-day, but really it's 28 days.
Yeah,
Yeah.
that's true.
So, but I won't say like month long or 30-day, but it really is 28
Yeah.
days.
And soon will be a
24 weeks.
14-day because that's where it's trending.
Yes, it is starting to trend that way.
Yeah,
Unfortunately.
sure.
And yeah, I agree. So, week one, you're not feeling great. Even if you went to a detox facility prior, right? There's a lot of residential inpatient treatments don't provide detox on site. So even if you did that, still week one coming into a 28-day program, you're generally not feeling well.
No.
You're generally struggling. And so then maybe end of week one, even in that scenario, you're starting to get comfortable. You're starting to figure out how things work,
Yeah.
where you're supposed to be, who all of the players are.
Yeah.
Like you're just starting to learn people's names.
Yeah.
And week two is an experience of that. I'm just trying to figure out my bearings here.
Yeah.
Week three, you actually can start to get into some actual treatment, right? Some actual education, start to really gain from the process. And week four, you're discharge planning.
I know.
It's a real shame that it continues to even cut down from there. 'Cause what I've seen in my experience is the longer somebody can be in inpatient, right? Says for somebody that has not experienced inpatient before,
Yep.
right? The longer you can be in that experience, the better you're going to transition into next level of care.
Right.
The easier that transition will go, the more prepared you will be. The fog lifts more. I mean, this is your brain on drugs, the old thing that
Yeah.
we used to see, the fried egg. There is truth to that. Like the drugs and alcohol do damage your brain, and it does take time to heal. In fact, time is one of the only things that will heal. Regular exercise, good diet can speed that up, but it still takes time.
Yeah.
30 days in, I mean, my best thinking 30 days in was okay, I can be sober,
Yeah.
but I'm still going to go buy a bunch of drugs, traffic them,
Yeah.
and sell drugs, and I'll do that sober, think how much money I'm going to make. That was my best thinking at 30 days sober.
Right.
I was not fit for public consumption, you know?
Well, I will say this. There is a massive difference in our decision making comparative to 30 days sober to 90 days sober.
Yes.
But if I were to take that same timeline and let's say 1 year sober to 15 months sober, I wouldn't say that there's that big of a massive jump. There is a jump.
Yes.
But 30 to 90, 30 to 45, 45 to 60, right? We start getting into some massive jumps. I would say that the discharge planning of good inpatient treatment centers last much longer than a week.
So is that something that you would designate like here is a symptom of a sign of a quality treatment facility? Mm-hmm. Is that one of the things you would put on the list?
Yes.
Yeah.
A treatment center that is not, I'm going to have to be careful with how I say it, that is not looking for repeat business, and they're looking for continuation of treatment. And they're told that on the front end when they talk to a guy like me. That says if your son or daughter comes here, right, depending on gender specific, if your loved one comes to this program, we are committing to not just this program, but a bunch of hypotheticals of what would be best for your loved one for the continuation. Because we're going to do surgery on your son's legs, and he's not ready to sprint when he gets out of here.
Yeah.
There's a lot of physical therapy. We're going to learn how to put on our shoes, and we're going to learn how to maybe get out of bed on our own and stand stable, and then we're going to start walking, and then we're going to skip, and then we're going to jump rope, and then we're going to run. Yeah. That's a long time. And so if he comes here for 14 days or 28 days and then goes right back to whatever he was doing, you can't come here.
Hey, look, I'm fine with throwing this stuff out there. Like, I
Cool.
don't want to focus on all the negative in it.
Sure.
I would like to stay focused on the positive, but the reality is there's negative and there's stuff
Yes.
that needs to be discussed here.
Yes.
And there is a sect of this industry where they have created what I call revolving door or bed and breakfast style treatment.
Yeah.
And that the whole goal is that individuals they enjoy their time there, but they don't get too well.
Yeah.
And that's so.
I just think people need to understand what they're providing.
Yeah.
And it's okay. Think about what we provide a certain thing. We're not detox. We're not inpatient treatment. If that's what someone needs, then we're not the right place. You know, we also we're not a good fit for everybody, and even aftercare. But just if a good inpatient treatment center just understands who they are,
Yes.
they're huge on discharge planning and aftercare. Not just handing a piece of paper with 10 places and phone numbers that who knows if they're even updated as far as the correct phone number. Is that place even still open? It's just like an interventionist would get to know a family on the uniqueness of that family and how to handle those boundaries and how to handle where we're going to go and how we're going to handle it. It's the same process with a case manager or a clinical team and a discharge planner as a team to strategically understand where this person's at, where do they need to go, and how do we need to get there. And that discharge plan is longer than a week.
Yeah, absolutely. It takes longer than a week. Okay, that's a great designator, but it's not necessarily something you can see on the front end,
Right.
right? Like if you're looking at websites or you're talking to anybody, right?
Yeah.
You may not actually know what goes on in that. I mean, that's a
Right.
good question to ask. What does your discharge planning look like?
It's going to be tough to know anything from a website, no matter how good or bad a program
I
is.
agree. But what you find is that a lot of places say that they offer everything.
Yeah.
Honestly, if somebody says that they're great at every single possible facet
Yeah.
of treatment, that's a red flag.
Mm-hmm.
That is a sign of a revolving door treatment facility.
Yep.
Right? When
Yeah.
somebody says on their website they do equine therapy, ask about it. What does that actually look like? How many hours are they doing that?
Mm-hmm.
Is there an actual equine therapist? Right? Get that information.
Sure.
You know, if that's something that you're actually interested in your loved one doing and you believe would be beneficial,
Yeah.
then get all the information on it. If somebody says they do EMDR and they're trauma, are they trauma informed or are they trauma focused? How does that work? What are we doing around that? How many therapists do you have doing that?
Sure.
I think it's okay to ask questions like, what's the caseload? How many individuals is each therapist seeing?
Yeah.
Right? What does the curriculum look like? You
Yeah.
know, what kind of medications are allowed?
Yeah.
Right? What these are the questions we need to ask, in order to identify what's good and what's bad. A lot of times when somebody calls Lighthouse, they're talking to you. It's a different situation. And a lot of times when people are calling these larger facilities, they're just talking to somebody in a call center.
Yeah.
They've got a headset on and they're just answering call after call after call. And really their concern is just, do we accept your insurance policy?
Right.
Right. As unfortunate as that is, I know it sounds dark, but that's reality.
Yeah.
And so getting to somebody that actually understands what's going on and can actually intelligently discuss what's happening in the treatment.
Sure.
How it actually works.
Well, and as you know, many people find us just through word of mouth.
That's right.
Right. You got to call my guy.
Yeah.
For a lot of things, if it's not just getting on the internet of who can mow my lawn, right? You ask your neighbor of like, hey, who mows your lawn? It's getting a reference. People take that very serious because they've had a good experience.
Yeah.
I think just talking about what you have going on and making a bunch of phone calls could be very beneficial because you start weeding out things like that. But ultimately, you want to be able to find a community or people who've had good experiences at these places, and then that way, you know what I mean? Does that make sense?
Absolutely. Well, and that's why I said we started with this whole thing when I was talking with Brooke, with Dr. Keels, a couple weeks ago. Here's the starting point. Start with the therapist.
Yeah.
Right? As if a therapist doesn't know directly, they know people that do.
Yeah.
Right? So, let's start at this starting point. I know what I just kind of finished with there can give, a pretty dark glimpse into all of this.
It's the reality.
Yeah, but I do want to finish this up with, we're going to talk more about this in the next episode.
Okay.
But there is good help out there. What I'm trying to provide here, what we're trying to provide here, is education for families and individuals so that they can determine themselves what is quality care and what isn't, and what is the right track to go on for my loved one, or how do we even begin to find that?
Sure.
So there is hope out there for you. There are people that care and that will do the time and they're put in the time, and there are the right facilities out there for your loved one. So thanks again for joining us on Pretend I Don't Know Anything, and see you soon.